Welcome to this webinar titled Medication Management, Reducing Falls Risk and Adverse Drug Events. My name is David Mott, and I'm a professor at the UW-Madison School of Pharmacy. The content for this program comes from research that I coordinated related to pharmacists and communities reviewing medications for older adults with an eye toward making the medication regimens the older adults were using safer in the sense of reducing the risk of falling due to medications. Some of the content is derived from the medication management session of the Stepping On Falls Prevention program that myself and Beth Martin have provided to groups of older adults. I would like to acknowledge several people and organizations with whom I have worked or supported our falls prevention work. Jeff Kirshner is the owner of Stru's Pharmacy in Green Bay, and he has been a tremendous pharmacy leader in our programs. Second is the amazing administration, staff, and volunteers at the ADRC of Brown County. They have been so supportive and instrumental in our work. My School of Pharmacy colleagues, Beth Martin, Bob Breslow, and Amanda Margulis, have each contributed their clinical and research expertise to the program. Also, I acknowledge the Interdisciplinary Center for Translational Research at UW-Madison for grant support for our work. Finally, I want to acknowledge Northeast Wisconsin Chapter 171 of the National Association of Orthopedic Nurses for supporting the recording of this webinar. This is the outline for the webinar. I will start with some higher level background information and then dive into some of the specific medications that are particularly troublesome for older adults and which should be the target of a review conducted by a healthcare provider when attempting to reduce the falls risk for older adults. The medications include both prescription medications and over-the-counter or OTC medications. Assessing the appropriateness of OTC medications is especially important since OTC medications sometimes are forgotten about or patients assume they are always safe to use because they are available without a prescription. Older adults as an age group population use a disproportionate amount of medications, both prescription and OTC medications. As we age, we are more prone to suffer from chronic conditions, and luckily, we have developed many medications that can be used regularly to manage chronic conditions. Medication use among older adults is very pervasive, as about 90% of older adults take at least one prescription medication, and about 1/3 take 5 or more daily medications. This is what is called polypharmacy or polymedicine. Also, about 1/2 of older adults use a herbal supplement or a dietary supplement, such as vitamins or minerals to supplement their nutrition. About 75% of older adults using a herbal or dietary supplement do not inform clinicians about this use, reinforcing the idea that health providers need to cue patients of all ages about prescription, OTC, herbal, and dietary supplements when checking the appropriateness of medications. So, from a medication use perspective, older adults as a group are more at risk for bad events happening from medications simply because they take more medication. Their medications should be reviewed regularly, and their use should be monitored regularly. Medications are an essential element of our modern approach to treat and manage acute and chronic conditions. When medications are used for the appropriate condition, taken in the manner in which they should be taken, and their therapeutic and non-therapeutic effects are monitored regularly, they can be a very positive experience for a patient. However, medications can cause some problems for patients. A side effect is an action of a drug other than the one for which it is being used. Dry eyes, dry mouth, dizziness, and drowsiness are all examples of common side effects of medication. An adverse drug event, or ADE, is defined as an injury resulting from the medical use of a drug. Examples include falling, hospitalizations, and an ER visit. 33 to 42% of all ADEs are preventable, meaning the harm does not have to happen if medication use was regularly evaluated and monitored appropriately. What drug classes are particularly prone to causing ADEs? Well, analgesics are the leading drug class associated with preventable ADEs. 29% of all preventable ADEs are associated with analgesics. Next is sedatives, used to help patients sleep, associated with 10% of all ADEs. Antipsychotic medications that have significant central nervous system or CNS effects also are associated with many ADEs. Combined, analgesics, sedatives, and antipsychotics are associated with 46% of preventable ADEs. ADEs are important. ADEs are the fifth leading cause of death in the United States. More than 2 million patients each year experience a severe ADE. About 1/3 of drug-related hospitalizations and 1/2 of drug-related deaths occur in people over age 60. The incidence of ADEs among older adults is 20 to 25%, compared to 2 to 10% for young adults. In a study of elderly veterans, 35% had at least one ADE in the past year, and 1/4 of those required a visit to an ER or a hospital admission. Older adults are more at risk for ADEs due to changes in our bodies as we age. Physiologically, as we age, we tend to lose muscle mass, making our large muscles weaker. This also decreases our core strength and stability. We also begin to lose renal and liver function, which from a medication taking perspective reduces our body's ability to break down and remove medications, allowing the medications to stay in our bodies longer. Also, our sensory perception decreases, so we are less able to adjust to changes in our environments. It takes longer for nerve messages about warnings to get to our brains and then out to our muscles so we can avoid the change in our environment. In other words, our quick twitch reflexes decrease, preventing us from avoiding harm. Also, since our muscles lose strength, this also contributes to our inability to quickly move to avoid danger. Those are normal processes that happen as we age. That is why regular exercise is so important to maintain muscle strength, agility, and balance, all key aspects of falls prevention. The polypharmacy issue, combined with the physiologic changes, increase older adults' risk for ADEs. Taking many medications that can interact with each other, combined with the fact that many medications are removed from the body via the kidney and liver, combined with the fact that many medications can impact the CNS system, and combined with a reduction in sensory ability, all place extra emphasis on assessing medication use in older adults to avoid harm. So let's review. As we age, the incidence of chronic conditions increases, and with it, the likelihood of needing to use medications increases to manage the chronic conditions. Next, our bodies change as we age. The changes are particularly important as it relates to medications, since the removal of medications is decreased, increasing the amount of the medication in the body to cause problems. Additionally, many drugs have central nervous system effects that can further reduce the ability of an older adult to adequately assess via their sensory system changes in their environments and avoid harm. Drug effects can appear randomly and often are accepted and mistaken for problems associated with old age, the so-called "it's just old age" phenomenon. This view tends to hide these effects, and then they are not addressed. This slide lists examples of signals of possible medication problems that should be discussed and addressed. First, falling is not just a sign of getting older. There are many consequences of medication use that likely contribute to the many other factors that are related to falling. The effects of medication should be considered as part of a thorough falls prevention approach for an older adult. Another example is dizziness upon standing. Many times in older adults, this phenomenon is caused by a dose of a blood pressure medication that is too high. Dizziness upon standing can be more prevalent in hot summer months that naturally cause vasodilation. Orthostatic blood pressure should be checked in relation to dose of blood pressure medications to help prevent this side effect. In summary, these are not just signs of getting older. These effects should be assessed in older adults using medications. There are several categories of drugs that have a higher risk of being associated with falls. We call these drugs falls risk increasing drugs, or we use the acronym FRIDS. These are very common categories of drugs that are used by older adults. Sedatives include sleeping medications. Antipsychotics are used for dementia and other brain issues. Antidepressants commonly have an impact on the central nervous system and can cause drowsiness and increase feeling sluggish. Anticonvulsants commonly are used by patients with epilepsy or patients who may have brain conditions that make them susceptible to seizures. Antihistamines are used to treat runny noses and allergies and can be used as sleeping medications. Diphenhydramine is an antihistamine that is used for its side effect of causing drowsiness and promoting sleep. I will talk more about this drug later. Anti-anxiety medications also act on the central nervous system and can cause drowsiness and sluggishness. Valium or diazepam and Xanax or alprazolam are common examples here. Antihypertensives are commonly used for high blood pressure, and dosing issues are the main concern with these medications. Finally, drugs used for Parkinson's disease commonly have central nervous system effects that cause drowsiness, dizziness, and sluggishness. Here are some common bad effects caused by FRIDs. Think about the effects on the left of the slide in combination with the normal physiological changes we experience as we age that I discussed previously. All of these effects on the left increase the risk of falling among older adults because they make worse the normal processes happening in our bodies. There are 3 strategies that we encourage providers and patients adopt if they are using a FRID. The first is to stop taking a FRID or never start using a FRID. Avoidance is a great way to prevent the bad effects from a FRID. The second approach is to see if the dose of a FRID can be lowered. Oftentimes, a lower dose will remove some of the bad side effects that can contribute to falling. If the dose is lowered, the effects of the lower dose should be monitored to make sure a therapeutic effect is being obtained. A prescriber, nurse, or pharmacist can help with altering and monitoring the dose of a FRID. Third, sometimes a FRID needs to be used. In this case, it is important to work with your providers to monitor the effects of the FRID. Patients' reactions to drugs are very different. It is possible that a patient can safely use a FRID. The point here is that the patient and the provider should be aware of any side effects, so the FRID use is viewed as safe. Knowledge is important here. Take time to understand what the effects of medications are, how you react to the medications to stay safe. Also, always read labels and ask questions about medications to learn more about the medication. For example, if you are concerned about falling, specifically ask prescribers, nurses, and pharmacists how each medication could increase your falls risk, how you can monitor the effects, and whether there are safer alternatives for you to use. Here is a typical drug facts section of an over-the-counter drug label. Pay particular attention to the active ingredients section and the warnings section. In the warnings section, you will see some of the common effects of the medication. Pay attention to the effects I discussed previously, like drowsiness, dizziness, sluggishness, and blurred vision. Many medications cause these effects because they impact the central nervous system. For prescription drugs, you should ask your pharmacist for information about the medication. A particular concern is medications used for allergies and as sleeping aids. Many of these medications are purchased over the counter without a prescription. A medication that commonly is used for both conditions is diphenhydramine, which is a powerful antihistamine that has several side effects that can increase the risk of falling. It has several uses and is available in several forms. It is found as a single entity drug or in combination with cold medicines and pain relievers. When used as a sleep aid, it is sold under different brand names or generically as diphenhydramine. To me, it should not be formulated with pain relievers and sold as a PM medication. The underlying sleep issue needs to be addressed, and if a sleep agent is needed, better ones are available. Diphenhydramine stays in the body a long time. In other words, it has a long half-life. And a person can be drowsy, dizzy, have blurred vision in the middle of the night or in the morning upon waking. As we discussed, drowsiness, dizziness, and blurred vision can lead to falling. Other sleep aids have a shorter half-life, so the drug is gone by the time a person wakes up, decreasing the risk of falls. Consult a prescriber or pharmacist about safer sleep aids. On the flip side, diphenhydramine is an important drug, especially in preventing anaphylactic shock when people are exposed to things to which they are allergic. When used correctly, it is a good, useful drug. Unfortunately, as I said, it is added to multiple drugs in over-the-counter medications, such as cough and cold medications and pain relievers, such as Tylenol PM. You need to be careful with diphenhydramine and read labels to identify when diphenhydramine is present, and talk with prescribers, nurses, and pharmacists about diphenhydramine. Here's some more information about diphenhydramine and some common products that contain the drug. A study published in 2001 in the Archives of Internal Medicine found that a group of hospitalized patients 70 years and older who were given the drug had significantly increased risk of altered attention level, disorganized speech, change in consciousness and alertness, and behavioral disturbances. Some people do fine using this drug. You should assess how you react to the medication and talk with a prescriber, nurse, or pharmacist about alternatives. In the worst cases, diphenhydramine can cause delirium and even hallucinations. Geriatric specialists say the drug is not recommended for older patients. It really can have profound effects in older people. When you weigh risk-benefit overall, you may experience more harm than good, and that's never the end result that you want. Here are some suggestions for improving sleep. Stick to a sleep schedule. Keep your bedtime and wake time consistent from day to day, including on weekends. Get out of bed when you're not sleeping. Sleep as much as needed to feel rested, and then get out of bed. If you can't sleep, get out of bed after 20 minutes and do something relaxing, such as reading. Avoid trying to sleep. The harder you try, the more awake you'll become. Read or watch television in another room until you become very drowsy. Then go to bed to sleep. Use your bed and bedroom only for sleeping or sex. Don't read, watch TV, work, or eat in bed. Find ways to relax. A warm bath before bedtime can help prepare you for sleep. Having your partner give you a massage also may help relax you. Create a relaxing bedtime ritual, such as reading, soft music, breathing exercises, yoga, or prayer. Avoid or limit naps. Naps can make it harder to fall asleep at night. If you can't get by without one, try to limit a nap to no more than 30 minutes and don't nap after 3 p.m. Make your bedroom comfortable for sleep. Close your bedroom door or create a subtle background noise, such as a running fan, to help drown out other noises. Keep your bedroom temperature comfortable, usually cooler than during the day and dark. Don't keep a computer or TV in your bedroom. Exercise and stay active. Get at least 20 to 30 minutes of vigorous exercise daily, at least 5 to 6 hours before bedtime. Avoid or limit caffeine, alcohol, and nicotine. Caffeine after lunchtime and using nicotine can keep you from falling asleep at night. Alcohol, while it may initially make you feel sleepy, can cause unrestful sleep and frequent awakenings. Avoid large meals and beverages before bed. A light snack is fine, but eating too much late in the evening can interfere with sleep. Drink less before bedtime so that you won't have to urinate as often. Check your medications. If you take medications regularly, check with your doctor to see if they may be contributing to your insomnia. Also check the labels of over-the-counter products to see if they contain caffeine or other stimulants, such as pseudoephedrine. Don't put up with pain. If a painful condition bothers you, make sure the pain reliever you take is effective enough to control your pain while you're sleeping. And hide the bedroom clocks. Set your alarm so that you know when to get up, but then hide all clocks in your bedroom, including your wristwatch and cell phone. The less you know what time it is at night, the better you'll sleep. Let's talk a bit about what you can do to decrease the bad effects of falling. The first deals with vitamins and supplements. Vitamin D is found in many dietary sources, such as fish, eggs, fortified milk, and cod liver oil. The sun also contributes significantly to the daily production of vitamin D, and as little as 10 minutes of exposure is thought to be enough to prevent deficiencies. The term vitamin D refers to several different forms of this vitamin. Two forms are important in humans: ergocalciferol, or vitamin D2, and cholecalciferol, vitamin D3. Vitamin D2 is synthesized by plants. Vitamin D3 is synthesized by humans in the skin when it is exposed to ultraviolet B, UVB rays from sunlight. Foods may be fortified with vitamin D2 or D3. The major biologic function of vitamin D is to maintain normal blood levels of calcium and phosphorus. Vitamin D aids in the absorption of calcium, helping to form and maintain strong bones. It is used alone or in combination with calcium to increase bone mineral density and decrease fractures. Recently, research also suggests that vitamin D may provide protection from osteoporosis, hypertension, which is high blood pressure, cancer, and several autoimmune diseases. Calcium also can help with bone strength. Several foods are good sources of calcium. An 8-ounce glass of milk contains about 300 milligrams of calcium. You can also take a calcium supplement, and there are several that can be purchased. They all are basically the same, but calcium citrate is the form in which the calcium is available, is absorbed somewhat better by the human body. In summary, how can you get the best results from your medications and avoid side effects and ADEs? You should ask several questions about your medication use. The first question is a risk-benefit question. Do the benefits of the medication outweigh the risks of the side effects? Sometimes we need to use a medication, like a FRID, due to the benefits. For example, the FRID may be the only medication that works for you. In these cases, it is a good idea to monitor how you react to the drug and try to prevent bad effects like falling while using the drug. Second, it is always good to explore non-drug options for a condition. Adopting various sleep strategies is a good example, as we discussed. Health providers can help with non-drug strategies or other concerns. However, sometimes there are not effective non-drug strategies, so we need to be careful with drug therapy. Third, explore whether any new symptom or problem could be linked to a medication or medications that you are taking. Sometimes side effects occur randomly, and you need to pay attention to them and talk with your providers if and when they occur to determine why they are happening. I like to encourage people to have their medications dispensed at one pharmacy, so the pharmacy has a complete list of all of a patient's medications. A complete list is very important to solve some of the problems that we have discussed so far. I often take my complete list from the pharmacy with me to medical appointments to make sure the lists match. Lastly, please talk with your pharmacist about medication issues if you are not doing so. Pharmacists are very knowledgeable about medications. They are very accessible, and they are very willing to help you with your medication questions. That said, pharmacists are very busy people. Please be prepared to call and schedule an appointment to talk with your pharmacist. This may seem strange, but many pharmacists I know actually prefer you do this so they can set aside time to devote all of their attention to you and your questions about your medications. I have even heard of pharmacists coming to patients' homes to discuss their medications. How great is that? Lastly, in keeping with talking with a pharmacist, ask a pharmacist to review your medications for you. I think this is very important to make sure the medications you are taking are working for you, determine which medications you no longer need to take, and decrease the chances for any side effects. I think older adults should receive a medication checkup at least once per year, and I prefer every 6 months. Think about getting our teeth cleaned and checked every 6 to 12 months. A medication check is just as important, if not more important. Also, most Medicare Part D plans cover this service. Please ask your pharmacist about this so you can reduce your risk of falling and prevent any adverse drug events. Thank you for your time, and I hope you found this webinar to be useful for you.